Hi everyone, for week 2 in Fundamentals of Occupational Therapy Practice. And I've titled it Professional Reasoning 1 because, as I've already said, we're going to be thinking a lot about reasoning, but this week we're going to focus on research and evidence in occupational therapy practice, and particularly the evidence-based practice part of that. The reason we're doing that is because, as I've already said, one of the key aspects of this course is professional reasoning. So we want you to start thinking about developing skills and knowledge in understanding how occupational therapists think, and also you starting to develop the ability, the skills in thinking in that way. Now, one of the issues which often gets in the way is that sometimes occupational therapists think there is no reason, rhyme or reason, to the way that we think about things in practice. Or, as I think I've said, sometimes we talk about it as common sense, but it isn't that, as we've talked about. You already have lots of knowledge and skills that you can use to think about what you're going to do with clients and how you're going to do those things with clients. And one of those is the Canadian Practice Process Framework, the CPPF. The CPPF is really useful, as we've already talked about, because it is a process which guides us through practice, but it is missing. It doesn't tell us how to think. It tells us what sorts of things to think about, but it doesn't give us any support in terms of how do we make a judgment about when we've identified occupational issues and the underlying causes of those, what sorts of things might we need to plan on and then implement with that client in order to address the occupational issues? How do we prioritise? How do we make sure the client is engaged in therapy? So while this is very useful and we will continue to use it because it is a good process, it doesn't tell us that how, and that's what professional reasoning is part of. When we talked about the CPPF last year, the book very clearly says that the CPPF is an evidence-based, client-centred and occupation-based process, and we're going to concentrate and think a bit more about what is evidence-based and what does that mean. We've already talked a lot about occupation-based, the way that the CPPF is occupation-based. We will talk more about client-centred, but today we want to think a bit more about evidence-based. So what is evidence-based? Evidence-based practice, all those sorts of terms. The term first came about in medicine, and so when you're reading, you'll read a lot about evidence-based medicine, particularly if you read some of the older literature about evidence-based medicine, but has been broadened to think about evidence-based practice, because lots of professions, not just medicine, are now trying to be evidence-based in the way that they work with clients and service users, and occupational therapy is no different from that. The term was originally used, evidence-based medicine, to capture the idea that it was about the conscious, explicit and judicious use of current best evidence in making decisions about the care of individual patients. So first of all, it was a very upfront, explicit process. It doesn't just happen, you have to engage in this. The other aspect that is important is that it's the judicious use of current best evidence, and we'll come back to that in a moment. It's not just unquestioningly following the evidence, but doing that in a judicious way, and as I say, we'll come back to that. But ultimately, it's about helping practitioners, in this case, in this definition, about doctors making decisions about the care of individual patients, and similar principles for occupational therapy and other professions, in fact. The term that we're going to use is evidence-based practice, and the term that you'll see used because it tends to encompass more professions than medicine is evidence-based practice. And one of the things that's worth noting is that occupational therapy has contributed quite a bit to evidence-based practice. For example, the two of the authors down the bottom there, Tammy Hoffman and Sally Bennett, are both occupational therapists. But also McMaster University Occupational Therapy Department has done a lot in relation to evidence-based practice, and you'll probably see some of their work along the way. So evidence-based practice is the term we're going to use. Now, the definition of evidence-based practice builds on, but expands that one we've just covered from medicine. So evidence-based practice is certainly about using research evidence, over there to the right, but also recognising that when we come to an encounter or to working with a client, we're bringing as individuals and as professionals, particular types of professionals, a very specific clinical expertise. So we have a professional perspective, professional knowledge and skills, but also as individual people we have different experiences and different interests and so on that we bring to the encounter. It also recognises that each client that we work with has particular values, circumstances, attitudes, beliefs, etc., and that we need to take those into account as much as possible in practicing in an evidence-based way. And finally, the fourth aspect is that different contexts in which we work and in which we work with clients will have different expectations, different resources, and so those also will influence evidence-based practice. So evidence-based practice, a more modern definition, and the one we're going to be focusing on, means it's about using all of those four things to help us make decisions about what to do with clients, whether they be individuals, groups, or community. One of the things I want you to really think about and be very critical of when we're talking about evidence-based practice is it isn't only about using research. That is one of the aspects. And one of the things that happens in occupational therapy sometimes and in other areas, I suspect, is that people get hung up on the research. If there is no research, then we can't work with that group of people, or we can't work in that particular way. Or if there is research, then it means we have to do X, Y, and Z. That is not the case. It is one of four of those elements that we need to be thinking about. Because sometimes if there is no research evidence, then it doesn't mean, or shouldn't necessarily mean, that we can't provide a service. It just means we need to think more and draw on perhaps our professional clinical expertise, pay more attention to clients' values and what's available in the practice context if there is no research. So really think about evidence-based practice covers all of those four elements have to be present. Why is evidence-based practice important? It's important for a number of reasons. First of all, it enables us, and I guess this is in some ways the most important one, is it enables us to provide effective services for clients and therefore hopefully make sure that they have as positive outcomes as possible. Okay? Effective care for improved client outcomes. Hoffman, Bennett and Delmar also talk about how evidence-based practice as a way of working promotes an attitude of inquiry within, I'll use the therapists, occupational therapists, although they talk more broadly than that. And I guess that's about not just continuing to do what always has been done, but questioning and thinking about why are we doing those things and how can we make them better. The third reason why evidence-based practice is important is because it enables us, hopefully, to inform decisions about how to use our limited health resources in a wise way. There are only so many occupational therapists, there's only so much money, there are only so many pieces of equipment, etc. that we have, and what is the best way to use those? And can an evidence-based practice approach help us make decisions about those things? And one of the arguments is that it can do all of those things. So evidence-based practice is important, and it's here to stay for the time being anyway. It fits within the CPPF, and I want you to just have a bit of a think now for 2 minutes about where do you think it fits within the CPPF, evidence-based practice? It fits particularly within the societal context and practice context. So thinking about the societal context to start with, there is an expectation in wider society that we practice in an evidence-based way. And some of you may be aware of that, some may not. But thinking, for example, about lots of the press that there has been for a number of years now, actually, about vaccination for children, there is a lot of discussion about what is the evidence for the link between vaccinations and various health conditions in children. What is the evidence that it does prevent infection from those diseases? So there is a growing expectation out there that health professionals, including occupational therapists, practice in an evidence-based way, and it's probably not uncommon for an occupational therapist to be asked that by a client. It's also present in terms of the practice context. both personal and environmental. So personal, first of all, it's really about your knowledge, skills and abilities to use the evidence, but also your professional expertise. So it's certainly part of that. And also environmental, so thinking more down to the service or the organisation you're working in. Some, if not all, will have an expectation of evidence-based practice, but some will go even further and have very strict guidelines about how practice must be evidence-based and occupational therapists must be contributing to the evidence base, etc. So it certainly fits within the CPPF, and we'll be talking more about that. The final thing I want you to think about, and is what the book chapter reading is about, is the link or the differences, similarities between research and evidence-based practice. They are clearly related, but they are slightly different, and I want you to spend a bit of time thinking about that, and that's included in the worksheet, and we'll talk more in class. So that's it for now. I'll see you in class soon.